everyone. Dr. Van Merkel here. It's great to be with you. And today is May 28th, May 28th, just after Memorial Day. And I've had an interesting case come up here. I wanted to show you some things about it that's a little bit interesting. Okay. And hopefully give you a little more education about what's happening. Patient presents in February of 2019. Now, she's been a patient for a few years and a regular patient with no complaints at all, and well, no major complaints, a couple little things here and there that we took care of, and she was feeling good. But then in February, she had a cough, and she went to a medical doctor, found that she had lung cancer. Further evaluation determined the lung cancer came from her kidneys. Kidney cancer had metastasized to the lungs. So we have stage 4 kidney cancer before she even knows she has anything. Remember how I said how you feel is no indication of how healthy you are? And there's also no specific tumor marker for kidney cancer. None. The two things that are commonly elevated is CRP and ferritin and or LDH on various kidney cancers. Well, on a blood test that came in, we can see that now here's a blood test when she came in, already diagnosed with kidney cancer. Her LDH, code blue 315. Ferritin, code blue high 498, and CRP 48.6. Now, there is no tumor marker for kidney cancer. So at that time, we didn't run any markers, but at stage 4 kidney cancer, even with medical treatment, she has roughly 6 months to live. 6 months to live is it. So she elected not doing medical treatment because even the medical treatment wouldn't extend her life. So she wanted to know what we could do. We put her on an intense protocol, nutritional protocol, and you can see how her numbers dropped dramatically. And from February, pardon me here, this thing's annoying how that pops up. But from February to March, in 1 month, her LDH dropped from 315 down to 254. That's really good. Ferritin dropped from 498 down to 195, and C-reactive protein 48 down to 1.7. People, those are amazing results in just 1 month. That is phenomenal. But those are commonly elevated when there is kidney cancer. So we chart her again, and later in February, we start backing off the intense protocol, and it's still going down. The numbers are still improving here. And you can see them there improving nicely. Now, we hadn't run any. In February, we did run a cancer panel, and we found that her CA-125 was 19, a little bit elevated, not severe, but a little bit elevated. 2 years prior, it was down to 13. Now, that's the one that we would expect to be elevated if there is something going on with the kidneys that we need to really address. So she's doing pretty good. She feels fine. She has no symptoms at all, and she has gone 1 whole month feeling better, actually. Her cough is better, etc. So then we go and test her again in January, February, March, April. In April. And now her CA-125 is up to 26.5. So that has gone up. That's not good. Now, interestingly, her red blood count, hemoglobin, and hematocrit have elevated. Why would that be happening? I'm going to tell you in a second, but I want that kind of like percolate in your brain. Why would that be elevated with kidney cancer? Okay? We're going to talk about that in a minute. Now, her LDH, 254. Her ferritin is still good. This is a 70-year-old female, and her LDH is at 258. Now, it was 258. It was down to 235. So it's gone up a little bit by April. And we didn't really modify things too much, increase it too much, because the increase was just a little bit. We do see the red blood count, hemoglobin, hematocrit are going up. They have not dropped. They haven't gone down except after the first test. So now we tested her again in May 21st. And now we see that the LDH is up to 285. 285. That's code blue high Interestingly, the ferritin is still down. Now, we tested the alkaline phosphatase if it is metastasized where? If the alkaline phosphatase is high in the stage 4 cancer, it'd be where? Metastasized to the bone, exactly. But it's not elevated, so we don't have metastasis to the bone at this time. But we do have the LDH. The lung cancer is getting worse. And I'm going to address the red blood count, hemoglobin hematocrit here in a minute. But the LDH is 285. It started, and I apologize, 285 started at 315. So it's not as high as it was, but it's higher than it was after the first month. So that's not as bad. However, the CA125 that was at 19 has shot up to a red high of 43. Now that's high. It's only a little bit higher than it should be, but overall it's going up. It's going the wrong direction. So this is not good. The LASA test also went up, indication of general cancers overall. So in a month, this patient has gone the wrong direction, and we've got to see what we can do to get her on track. So I've given her an even more intense protocol to help her body fight cancer. Very intense protocol. And I'll report back here in a couple of weeks. So I'm going to have her retest. I'm going to have her retest the CBC, LDH, and CA125 in 2 weeks. But I want to explain why the red blood count, hemoglobin hematocrit are going up and what that indicates. Red blood count, hemoglobin hematocrit. Why would that be going up with kidney cancer? Well, doctors, you remember what the kidneys produce that stimulate the bone marrow to produce red blood cells? Erythropoietin. Erythropoietin is produced by the kidneys that stimulates the bone marrow to produce red blood cells. Well, as kidney cancer progresses, more kidney cells are out there, and they're pumping out more and more of this chemical erythropoietin, which is why that red blood count, hemoglobin hematocrit going up because of the kidney cancer. If we see those go down, as well as the LDH and CA125 in a couple weeks, we know we're on the right track. And so, but I want to explain why those are elevated. So if you ever see those elevated, you might think, okay, is there a disease of the bone marrow, severe dehydration, or this could also, the red blood count and hemoglobin hematocrit can also occur with chemical toxicity as well as hemochromatosis. But she doesn't have hemochromatosis, so that's not the reason why these are high. That's down. So chemical toxins can do it. Bone cancer or kidney cancer can cause that. So hopefully this gives you some more tools, a little more training on what you need to think about when you see labs. LDH is always an indication of tissue breakdown. Doesn't tell us where. It's not specific. It just says something bad is happening. Something bad is happening. So we're going to check in a couple weeks what's happening. We got her on a new intense protocol to boost her immune system. Now remember, we're not treating cancer. I don't have a cure for cancer. I don't have a treatment for cancer. Our goal is to get you healthier. And if we can get you healthy enough, can your body fight cancer? Now, we already have seen previously, earlier this year, how that has occurred on this patient. So keep track on this. This is a 70-year-old female with stage 4 kidney cancer. I'm Dr. Merkel. Hopefully this has been of help to you. We'll bring you an update here in a couple weeks. I'm Dr. Merkel. If you have problems, we'd love to help you. Have a great day. And like I said on the radio every day after my show, do something today to be healthier than you were yesterday. Thank you for listening. I'm Dr. Merkel. I want to give you just a little update on erythropoietin and the high red blood count, hemoglobin hematocrit. It is true that kidney cancer does produce excessive erythropoietin, but so does liver cancer, uterine cancer, and adrenal cancer, adrenal carcinoma. So it's not just kidney cancer that can be elevated, that can elevate the erythropoietin, but these other 4 cancers total, liver, kidney, uterine, adrenal, cancers can also cause an elevated red blood count. There are other causes of elevated red blood count, and we'll cover those at a later time. But when we were talking about cancer, I didn't want you to think that all you had to do was check the kidneys if you have an elevated red blood count, but there may be other things you need to check too. So keep that in mind. I'm Dr. Merkel. Have a great day.